A computerized tomography scan, commonly known as a CT scan machine, is a modern radiography machine mainly used by doctors to carry out several scans in the body or to assess serious head injuries. Medical experts believe it is one of the most effective tools for diagnosing various health conditions.
In the past, we used to have what we call a traditional X-ray. This one will be able to show you some area of disease, but will not exactly show you where the location is. But with this modern system of a computerized tomography, one is able to localize exactly where the disease is, and because of that, it improves the diagnosis for the doctors.
In Uganda, however, even with the high rate of accidents and various health conditions, the number of CT scan machines, especially in main government hospitals, still remains so low. The most affected area has been Northern Uganda, which doesn't have even a single CT scan machine in both government and private health facilities. Dr. Pira says this poses a big challenge in handling some of the health conditions. According to information obtained from the Ministry of Health, there are only 5 CT scan machines in government hospitals across the country, while the rest are in private hospitals. Some of these hospitals include Mulago, Chirudu, Kawolo, Mbarara and Uganda Cancer Institute. This has led to several referral cases from other hospitals. Some of the health experts believe this complicates their efforts to save lives.
The patients are there, the surgeons are there, but the issue is the equipment is not there.
Dr. Lima also notes the high cost implications involved with referral of patients to other hospitals.
There is a set of logistical arrangements. One, you need an ambulance, a standby ambulance. The ambulance must be fueled and the ambulance must be manned.
Gulu LC5 chairman Ojara Martin Mapenduzi has however blamed government for failing to prioritize quality health service to regional hospitals.
It's important that the Ministry of Health needs to realize that Ugandans are not doing well. So every day people have to drive 360 kilometers to Kampala to get these services. What is going on? The government of Uganda needs to know that these regional facilities that are here need to have all the equipment, the medical services that are key.
With the growing demand for the CT scan machine in the region, a team of Acholi religious leaders together with Lacho Hospital in Gulu have launched a drive to raise funds to acquire the machine.
This should have been the responsibility of government. Now when the citizens decide to run around looking for money, it's a vote of no confidence on the government.
In a phone interview, Dr. Jane Ruth Acheng, the Minister of Health, says government is in advanced stages of procuring the machine.
Government is already procuring CT scans for all the regional referral hospitals and has already placed that order. And not only CT scans, including X-rays, including upgrading all their intensive care units with monitors. Hopefully, if the items come in by December, we'll have. So if Lacho wants to mobilize for itself, Lacho is a private not-for-profit. It can go ahead. We also appreciate that because they look after a huge number of patients.
Nelson Omoya, NTV.